Hello everyone, in this video we will be discussing about the fluid management in burns. Remember that the fluid management is very important in burns patient because the most common cause of death in burns during first to third day is hypovolemic shock. So active fluid resuscitation can prevent the patient from death in burns. How we will manage the fluids in burns patient? For this we use different rules and different formulas. In this video we will discuss all of these formulas and how we should manage the fluids in burns patient. The first rule is that during the first 12 hours we should always prefer a crystalloid. We should never give a colloid because in burns patient there is increased capillary permeability. So if we give colloids, the colloids will leak in through these capillaries and will cause edema. So the fluid of choice in first 24 hours is crystalloid, and among the crystalloids the fluid of choice is ringer lactate. Now a question arises that how we should give a ringer lactate, mean what should be the dose of ringer lactate. So for this we use a formula called as a Parkland formula. The Parkland formula helps us to calculate the crystalloid given in first 24 hours, and it states that 4 multiplied by weight multiplied by total body surface area. This if we will calculate the weight, we will calculate the total body surface area, we multiply it with 4 and it will give us the amount of fluid which should be given in 24 hours. But remember, the interesting and the confusing thing about the Parkland formula is that the amount of fluid which is calculated from this formula, the half should be given in a first 8 hours and the remaining half should be given in remaining 16 hours. Let's calculate so it will help us to clarify the Parkland formula. For example, if a patient come to emergency with burns, the weight of a patient is 70 kg and the total body surface area of burn, which should be calculated through different rules which we will discuss in another video, is 20%. So we will calculate it according to the Parkland formula, the 4 multiplied by 70 multiplied by 20. It will give us the value of 5600. So half of this fluid which became 2800 should be given in first 8 hours and the remaining 2800 should be given in remaining 16 hours. Now another question arises that how we will confirm that the patient is actively resuscitated according to the Parkland formula. So to check the active resuscitation, we will check the urine output of a patient. If the patient age is greater than 14 years, the urine output should be greater than 0.5 ml per kg per hour. If the age is less than 14 hours, the urine output should be equal to 1 ml per kg per hour. And if there is a fourth degree burn, the urine output should be 1.5 ml per kg per hour. And if there is an electrical burn, the urine output should be 2 ml per kg per hour. So if these values are according with the fluid, so we will say that the patient is having a active resuscitation. So it was all about the Parkland formula, that how a fluid should be given in a burn patient for the first 24 hours. Now in children there is an exception to this rule. In children we give a maintenance fluid. So how we should give a maintenance fluid in children's? Maintenance fluid in children is given according to the weight of a patient. For the first 10 kg, 1 to 10 kg, the fluid should be given is 100 ml per kg for 24 hours. For 11 to 20 kg, there is 50 ml per kg for 24 hours. And if the weight is about 20 kg, the fluid should be given is 20 ml per kg for 24 hours. But it is a bit confusing. So how we will calculate it? Let's take an example and solve it. For example, if a child is weighing 60 kg, so we will divide the weight. The first 10 kg we will multiply it with 100. The next 10 kg from 11 to 20 should be multiplied with 50, and the remaining weight which is above 20 kg should be multiplied with 20. So if you look at this value, so how much weight is above the 20 kg? It's a 10 kg. So 10 should be multiplied with 20. It will give us the value of 200 ml. So if we add all of these value, it will give us the value of 1700. So in the 30 kg child, the maintenance fluid should be 1700 ml. So it was all about the fluid management of a crystalloid, that how we should give a crystalloid. Now come toward the colloid, that how we will give a colloid in burns patient. Remember that the replacement of a colloid should be done after 12 hours. In first 12 hours, the colloids are contraindicated because in burns patient there is an increased capillary permeability. So the colloids will leak through this capillary and will cause edema. So in the first 12 hours, the colloids are contraindicated and it should be replaced after 12 hours. And how we should replace it? We should replace it according to a formula called as a Muir and Barkley's formula. It will give a value according to which we will replace the colloid for 36 hours. How we will calculate the replacement of a colloid with the help of Muir and Barkley formula. To calculate it, we multiply the 0.5 with weight of a patient multiplied by total body surface area. This will give us a value called as a 1 portion. This 1 portion should be given at different time interval for the first 12 hour, next 12 hour and the next 12 hour. For example, if we calculate 1 portion and it became 100 ml. So the 100 ml in the first hour should be given at an interval of 4 hour. So 100 ml should be given in the first 4 hour, then 100 ml in the next 4 hour and the next 100 ml in next 4 hour. And after 12 hours it should be repeated at an interval of 6 hour, and that the last the 12 hour there should be given the 100 ml should be given in a duration of 12 hour. So this is how we will replace a colloid in burns. So it was all about the fluid management in burns. If there is still any question, you guys can ask and stay tuned for more update.